that, you will go to a pre-admission area, and that's where they will have
when
you change.
You say the front desk, so you talking about the main entrance?
No, go to the desk in the surgery center.
Okay.
So the elevator doors open up, and there's a desk, like, right there. So you can't miss it.
Okay.
So you'll first get registered, photo ID, insurance information. Then you'll go to pre-admission, and that's where they will start your IV, have you change into a hospital gown. Someone from anesthesia will come talk to you there. They are the ones that control your breathing and pain medicine during surgery. And then Dr. Teal will also come talk to you there and see if you have any last-minute questions before surgery.
Last-minute requests?
Yeah. Can you do a little tucking here?
Oh, I never known that.
Well, he can't.
I have thought of that. I've got this cyst right here, and love to get it removed.
That's not really his specialty.
Yeah,
he does sometimes remove gallbladders if they're diseased or something like that.
Yeah, I've had mine
general abdominal kind of areas. So.
I thought you meant a last minute back out, because I'm not backing out.
No, exactly.
Questions. Sometimes people do have questions right before surgery, like, I don't know, just random things that they think of. So he'll come talk to you before surgery just to make sure you get all your questions answered.
No, he has... There's another, when you say pre, because I have appointment the 21st, and it says pre-something.
That's your pre-surgery appointment, your pre-op appointment. So he'll talk to you then, too.
Okay.
But then right before surgery.
Okay.
So then
she said, like, last touch-ups. I was told that, well, I wasn't told, but I heard that some people, after they got the surgery, if they had loose skin. Mm-hmm. What is that?
A lot of people do. When you lose
Isn't
all
that
that
cosmetic?
fat, it's
you have
cosmetic.
to go to the cosmetic surgeon, and
it's
don't you have to take pictures to show the
insurance company? Yeah, it's really hard to get insurance companies to cover removal of the skin.
I said that.
I've wondered that.
Yeah. Some people, a lot of it is based on genetics, and so some people have a lot of excess skin and some don't. And there's no way. Exercise does help because it helps tighten up the skin a little bit. So if you keep exercising and building muscle as you're losing weight, that helps a lot. But ultimately, it's genetics that some people are blessed and some people aren't. So
I'm curious what each one of us are that go through this, like me.
Yeah.
I have no idea.
Yep.
I went hers my first doing this, and I heard some people come in for the surgery multiple, so this is new to me. Like her, I have a lot of curiosities.
Definitely. So after the pre-admission area, you go to surgery. And surgery takes about 45 minutes. So it's a pretty short surgery, really. You're in the operating room for a little bit longer because they position you and scrub your belly and all that sort of stuff. Then after surgery, you go to recovery room, which is also known as PACU. And there, basically, they make sure that you're breathing fine in your own, heart rate's good, blood pressure's good, stuff like that, before they take you up to the nursing unit.
So this is what always my question is, where is the PACU floor, and then where is recovery floor?
They are all of this so far is on the second floor.
Okay.
And then the nursing unit, like where you will spend the night and that sort of thing, is on the 6th floor. So OR and PACU and the pre-admission area and like the waiting room to the OR, all of that stuff is on the 2nd floor.
Okay.
So then they will take you up to the 6th floor of the main hospital. Recently been renovated, so they're all private rooms, which is great.
Oh, nice.
You have TV phones, typical hospital room things. There's a bathroom in every room, but the shower is down the hallway. And I always say they did that on purpose to make you walk more after surgery. So they'll let you shower the day after surgery. You just get to walk down there.
Are we going to have a drainage tube after surgery?
Not likely.
Oh, good. I was thinking I'm like, how am I supposed to walk? Because they're going to make you walk. How am I supposed to walk with this thing hanging off of me?
Yep. Probably will not have one.
Good.
But we will talk about it just in case. days when we talk about your incisions and stuff.
And if you said walk, that means that surgery's not going to be bad and pain. If you said the walk,
yes.
take the shower,
yep,
it's not going to be too bad.
It's not going to be too bad.
I had gallbladder removal surgery 3-4 years ago. No, I didn't think that was too bad. Is this any different? I didn't think
that's
so.
That's what most people compare this to.
Yeah.
Very similar.
Okay.
Yeah, because it's done the same way and you're kind of, you're doing similar things. So you don't have to move. A lot of the pain comes from having to move internal organs around. And with the gallbladder and with this one, you don't have to move a lot to get to what they need because they both of those organs kind of rest on top. So
yeah.
Let's see. So we would expect you guys to spend one night in the hospital. So you'll go home the day after surgery. Not usually early morning. It's usually after lunch, kind of afternoon time frame. If somebody can't come to get you till after work, that's fine. It's not a big deal as long as you're gone by midnight.
Yeah.
That's when the new day starts.
We love you, but not that much.
Yeah. That's when the new day starts. So when you guys wake up in recovery room, you will have a couple of things attached. This first one is called an abdominal binder. Just goes around your waist, almost like a girdle. Oh. I say it's holding everything in, not that anything's really going to fall out, but most people love this little device.
Because it's probably, you have to use your muscles to get out of bed, and I know when I had my gallbladder removal, that was really painful. I had to roll out on the side. It
helps you, and the nurses will show you the easiest way to get out of bed. But you kind of roll over on your side and then you sit up.
Okay.
Because that helps. And this will help some too. So this makes it a little easier to sit up, walk around, stuff like that. If you have to cough, it's really nice to have this on so you can kind of hold on to it.
I had other things in mind for that. Weight loss.
Yes.
Like a
girdle holding it all. Yep. And some people do continue to wear it. We'll send it home with you from the hospital.
I was going to say, do we get to keep this?
You do. You keep this.
Oh,
good. One gentleman said to me at support group that he wore it for 3 months after surgery, and I thought, well, that's a long time, but whatever, works for you, buddy. Some people say after 2 days it was driving them crazy, so they stopped wearing it. So it's really to help you out.
So. He probably didn't tell you the truth, but he was using it for
yeah, he probably was using it to hold up some skin there. We'll also have a pair of these on. These are called SCDs.
Oh,
they go on your legs. Yep, from about your ankle to your knee, and this will hook to a little machine that sits at the foot of your bed. This is going to help prevent blood clots from forming in your legs. So what happens when we lay flat or sit in one position for a long period of time, blood tends to pool in our calves and behind our knees, and when it pools there, it can clot. So this is going to help prevent those blood clots from forming. Some people love them, say they feel like massage. Some people, they drive them a little crazy because they cycle about every 3 to 5 minutes, so you're kind of constantly feeling that pressure on your legs.
Is it kind of like the when you're in the mall and you're doing those massage chairs and then the leg compression things, they massage your legs too?
Yes.
Okay, that's what I thought.
Yep, just uses air to cycle through. So, yeah. They're really important. Some people, they cycle 3 to 5 minutes. But when you're in bed, you're going to wear them because that's how important they are. So the solution is, if they do drive you crazy, get out of bed. Sit in the chair, walk in the hall, because then you don't have to have them on. But pretty much that night of surgery, the nurses will harass you to wear them. So,
I have a question.
Is that yours? I wasn't sure, and I did want to pick it up. I thought.
I don't know.
I could have dropped
I can, if you both need one, I can go grab another one. It's not a problem.
I have no idea. I don't remember bringing it with me unless
I
it was
didn't
with
want to
this.
take it, and
Go
then
ahead,
it was
that's
yours.
fine.
Are you sure?
Because I can just drink out of the side. That's what I was doing because I didn't know where mine went.
Thank you. I'm sorry.
That's okay.
What was I going to say? Oh. Why are you more susceptible to leg clots compared to just going to bed every night to sleep?
When they do surgery, when they just even opening you up for anything. So you are at higher risk with your gallbladder too. Just abdominal surgery in general makes you a little bit higher risk. And then during surgery, like at night when you're asleep, you actually move quite a bit in your sleep. But when they do surgery and they totally knock you out, you don't move at all. Mm-hmm. So that's those two things, just the abdominal surgery and then that time period where you're not moving at all, you're at higher risk, and then that risk sticks on for a while.
Okay.
So there's one other thing we do, and then there's one thing that you guys will do to help prevent those blood clots. So the other thing we do in the hospital, we'll give you a shot of a drug called Lovenox starting the morning after surgery, and it's a little bit of a blood thinner. The way it will work, lab will come in really early and draw some labs, like 4 or 5 a.m., and then the nurse will come in with that medication. She'll look at the labs, make sure everything looks good, and bring that medication in. And then probably the most important thing in what you guys are going to do is get up and walk. So the day of surgery, you'll get up to your room. They'll give you about 2 more hours to more fully wake up, and then the nurse will come in and encourage you to walk, and they'll walk with you. And we know that first walk may not be a super long walk in the hallway. It might be to the door of your room and to sit in the chair for a while, but just kind of mentally prepare yourself to walk a couple of times the day of surgery. And most people, it feels good because you're not in a horrific amount of pain, and it feels good to get out of bed because you've been laying in the bed for a while. So most people do really enjoy getting up and sitting up for a while. So,
and I don't mind the walk, but it's a difference when you have surgery because you don't know what it feels like.
It's a little different, and you will be slow, but it's not going to last that long, and so you just kind of you walk through it, you get through it.
I'm trying to think how it was for me when I had it. I didn't stay overnight in the hospital because I didn't have insurance. So they were wanting to until they found out I didn't have insurance.
Well, and most people for gallbladder